welcome to the Research Sofa episode 2. So I'm Emily from Closing the Gap Network, and I'm here today talking to Carolyn and David about primary care and the role primary care plays within the current pandemic and people with severe mental illness. So I'll pass you over to Carolyn now, who's going to talk a little bit more about primary care and people with severe mental illness.
Thanks, Emily. So GPs have been working really hard through the pandemic restrictions, going through lists of people who are vulnerable to check and contact them about shielding and to check on their well-being. But what GPs haven't been advised to do, but are doing in some practices, is to check on the people on their SMI register, because these people are vulnerable. These people might be very socially isolated. Their carers, if they have carers, might feel unsupported. We are doing this in my practice, and we found that, first of all, some of our phone numbers are not in date, so we're having to send letters to people. But we found that when we do contact them, they're actually really grateful. And whilst we're doing it to check on their carer status, their medication, are they up to date with the medication, we're also asking them, have you got any problems with your shopping? Do you need any help? Can we signpost you to any of the local groups if they're operating even virtually? And I think that it's important that we remember to do this now within the pandemic restrictions, but also think about what we need to do following the lockdown. Things won't go back to normal. These 50% of people with a severe and enduring mental health problem do not have any contact with specialist care at all, so they're totally cared for in primary care. And we perhaps need to think a bit more broadly than what we have to do in terms of the quality and outcomes framework, in terms of caring for this population. I just want to ask David whether he thinks that primary care has a role in looking after these patients.
Yes, so my name is David Shiers. My background is as a former GP, and I'm of course a carer of a daughter who's had a diagnosis of schizophrenia made over 20 years ago. So my take is that, speaking as a carer, that primary care is an incredibly important part of the service, both for my daughter, but also for us as a family. And it's a trusted resource. So these are very bewildering times and lots of uncertainty, lots of anxiety. As family members, we're not always seeing how much support we provide, to someone like my daughter in the community. So supporting us as families to be effective as carers is an important thing, and I think primary care is well placed to do that. And also in terms of, you mentioned that you're now going through the list of people you've got in your practice with severe mental illness, and to actually receive a phone call, some interest from primary care would be extremely important to us, to my daughter and to us as a family, because again, as I said, we do trust you. We're being bombarded. The news and the information that we can dip into is enormous at the moment, and often quite scary. So one of the challenges is trying to restrict the information we have to people who we know and trust. So although there are lots of challenges, I think primary care has a big opportunity here, and that's why it's good to be part of this conversation now.
So certainly our assistant practitioner who's been ringing patients, when she has got through to them, she says they are really pleased, really grateful that somebody has made contact with them. And we're able to provide information about where are safe places to exercise locally, what support groups and third sector services are available and what are operating virtually. And we really want to continue to do that following the pandemic restrictions.
But I mean, the other challenge also is it's scary, and to know how to access the health system if things are going wrong. And it doesn't necessarily mean that it's absolutely the COVID-19 issue. It could be something else. It could be a simple health problem, an infected toe, or something relatively straightforward. Where do you go? Who do you go to for help? So to think that your primary care has made it clear that we are accessible, we are interested in you, we are here to give some continuity, is incredibly important.
And so the aim of the special interest group in primary care in the Closing the Gap network is to ensure that we emphasise the role of primary care in managing people with severe and enduring mental health problems, but also think about research questions that need to be answered. And we want to think about research questions with patients, with people with severe and enduring mental health problems, but also include carers in that discussion. And that's one of the aims going forwards.
Well, I'm certainly pleased to hear that. I mean, I think carers are so invisible to the system. There's a recent editorial in the Lancet Psychiatry, and talking about the importance of research for people with severe mental illness, and there was not a single mention of the word caregiver. Now, I think that's a huge oversight, because fundamentally we are the backbone of the support for this population in the community, and to not think about the research issues that flow out of the current COVID epidemic I think it's a huge omission. So I'm clear that that's something we need to address.
And I think, again, going back to primary care, something that struck me is that we know as GPs who the caregivers are for people with dementia. We don't necessarily know who the caregivers are for people with SMI, and that's a big omission, which, you know, again, we would want to say to people, actually, when you have contacts with people with SMI, note it down on the computer. It's a really vitally important piece of information for the patient, but also for that caregiver. And if that caregiver is registered with you, flag their notes, because they're at increased risk of other conditions and need extra support from us.
That's right. And I was just going to say that, you know, the caregivers themselves, certainly if they're family members, tend to be often older family members with their own health vulnerabilities, and the complexities of if their health was to become compromised through this pandemic, the implications then for the person they give care to would be enormous. So that there are lots of uncertainties, but people who are in caregiving roles often have their own compromised health problems too.
So back to Emily.
Thank you, David and Carolyn, for highlighting some really important aspects of both primary care and of the role of caregivers within the current pandemic situation. So if anybody would like to join up with our primary care special interest group, please send an email to ctg-network@york.ac.uk. Thank you for listening. Bye.
Bye.